I'm Dr. John Montgomery. I'm a practicing GP in Govan Health Centre, which is in the south side of Glasgow.
Okay. Well, thank you very much, Dr. Montgomery, for agreeing to speak to us for this training programme. So could you start off by telling us why it's important to try to engage people who have got diabetes into the clinics?
Okay. I mean, diabetes is undoubtedly a condition with a significant amount of morbidity because of the complications that can arise from having the condition. So, for example, they're more predisposed to stroke, heart disease, blindness, renal failure, circulatory problems in the legs, and many others. So it's a disease in which the morbidity associated with it is extremely high. But also, as important is the fact that the evidence base for what we can do to minimise the complications is extremely good. It's also a condition that is increasing significantly. In 1992, when I first started having an interest in diabetes, we had approximately 92 patients with that condition. Whereas now I have 261 patients with that condition and rising. And if you look at that in a Glasgow perspective, Glasgow had approximately 18,000 patients with the condition in the late 1990s. It now has 55,000, and every year this increase is happening exponentially.
Right. So in terms of the clinics that you run, what creates some challenges in terms of, what are the challenges in engaging people to come to the clinics?
Okay, I mean, I think most of the practices in Glasgow will have organised diabetic clinics, and many of us have tried to organise it in what's called a one-stop shop, by which the patient comes along for their annual review. And for the vast majority of patients, that's an extremely useful and extremely valuable service. And the attendance rate at the clinic generally tends to be above 90%. So right. it's a service that's greatly valued by patients. However, there is a hard core of patients who persistently default from attending. And they're a big worry, because this is the very group in whom complications are most likely to arise. They're more likely to neglect their condition, and they're more likely to present with a complication. And that's extremely sad, because that was preventable. Yeah. As I say, we have so many interventions now for managing diabetes, particularly type 2 diabetes, that if we can engage with these patients, there is no doubt that we are in a position to minimise the morbidity that comes from the condition.
So really we're talking about sort of 10% of your target group are the ones that are the kind of hardest to get through the door.
Yeah, yes. Yeah.
And what have you done as a practice here to try and specifically target that 10%?
Well, we were one of the first practices to be involved with the Keep Well project, and we found that the community outreach workers were found to be extremely useful at assisting in getting those hard-to-reach patients who weren't keen to attend for the Keep Well check to come along and attend for it. And of course, because we'd been doing it for 2 or 3 years, the practice had built up a very strong relationship with the outreach workers. And I think that this can't be overemphasised enough. Primary care is based on good teamwork. Good outcomes come from good teamwork. So we built up relationships with them, and we wondered, could we apply the same principles to Keep Well to our hard-to-reach diabetic patients? So we had some initial discussions with the Keep Well team, and they were very enthusiastic. So we decided to pilot this, and ourselves and 3 other practices decided to see if, using the Keep Well principles, could we get this hard-to-reach group to attend. Again, everything was personalised. So in our own practice, we discovered that we had 14 patients who had defaulted persistently in the previous year. We looked at these 14 patients. We had dedicated reception staff who were responsible for organising appointments. We had our dedicated practice nurse who's responsible for organising the register. And we sat down with the Keep Well workers to look at what could we do as a practice to encourage these 14 patients to attend in the subsequent year. It was clear that the outreach workers themselves required some education about the condition, which was going to facilitate them when they were going out to have a discussion with the patients about why they should attend. So I organised a 2-hour teaching programme with the outreach workers to give them background information about the condition, which they found extremely useful. We then organised the various clinics. We also said to the outreach workers that we'd be extremely flexible when it came to the timing of the clinics, so that when the outreach workers were going out, they would be in a position to liaise directly with a dedicated member of staff to arrange an appointment time that most suited the patient.
What was the kind of result of the pilot?
Well, what we found was that the 4 practices were taking part in it, and 3 of those practices, like ourselves, were Keep Well practices. So they had that crucial relationship with the outreach workers. The 4th member had not been involved in Keep Well before, so they were almost acting as a control. The control practice decided that they would only use telephone contact with their hard-to-reach patients, whereas the Keep Well practices were going to use both telephone contact plus lettering plus home visiting. And what we found was that in those practices that the attendance rate became closer to 80%. Whereas interestingly enough, in the pilot practice, who only used telephone advice, they weren't able to have any of their hard-to-reach patients attend.
Right. So if you were going to give some advice to people that were maybe at the start of thinking about how to engage harder to reach people in diabetes clinics or COPD clinics, what sort of advice would you give them?
Well, I think again I would reiterate the need for looking at teamwork. If we look at, for example, our experience of Keep Well, when we started to do this, we quickly realised that the personalised nature is what patients respond to. So again, it's coming back to this idea that if you're going to look at how do you engage with these hard-to-reach patients, it comes down to teamwork, coordination, everyone working together, and the results can be quite impressive.
Okay, well, thank you very much for taking the time today to talk to us.
It's a pleasure.